welcome to the launch of the new Community Health Improvement Plan. My name is Sharon Mortensen. I serve as President and CEO at Midland Area Community Foundation, and more importantly for this, I'm a member of the Health and Human Services Council for Midland County, the group that helped to develop this plan. This plan is critical to help us achieve our community's vision statement, Midland County, an inclusive community, together, forward, bold, an exceptional place where everyone thrives. The Health and Human Services Council of Midland County works on those issues, health and human service needs. On the slide, you'll see the mission of the Health and Human Services Council. We're a collaborative group that comes together to work on big issues in our community that need addressing, challenges that we're facing as a community. We understand that families have complex needs that cut across agency boundaries, that collaborative services produce the best results, and that local people solve local problems. So the issues that we're talking about today impact many of us here in this community, many of our neighbors, and they're issues that you hear about frequently, those that do have negative impact here in our community. A comprehensive community health improvement plan was launched over 6 years ago, and we've been working on it, and you'll hear about some of the things that have been accomplished, but it was time to relook at the needs of our community, especially in light of what we've experienced over the last several years with COVID, the flooding in our community. So we had some new data sets to look at as well. So this plan brought many from our community together to look at needs in our community and what we needed to do to address those needs moving forward. This plan introduces 3 areas of focus. Some will sound familiar because they're ongoing issues that we need to address: healthy living, mental well-being, and substance-free resilience. So today we have folks that are working those areas of the plan to talk about this together. We have Catherine Tate from the Legacy Center for Community Success, Brent McCullough from My Michigan Health, Dr. Kathy Dollard from My Michigan Health, and Dina Shad from Community Mental Health for Central Michigan. So we're going to start with, can you describe the factors that prompted the focus on these 3 areas: substance-free resilience, mental well-being, and healthy living? And share a few key stats that caused you to look at this. So we'll start here with mental well-being.
Sure. So in 2022, Midland County did a health survey, and it's a survey that we have conducted every few years. And what we found was that, unfortunately, depression had increased in the population. So this is a survey of Midland County residents who are adults. And we found that there was a rise from 26% to 34% with people saying that they had suffered with depression. As well, people were having more anxiety. So we went from 29% to 41% with people reporting anxiety. And also, 18.5% said that they were limited in their activities due to their social or emotional or mental health problems. So we did see a rise through the pandemic in both of those issues with depression and anxiety.
In addition to the numbers that we saw with adults, we saw a similar pattern with children when we conducted our Midland County Youth Survey. Depression increased from 17% in 2016 to 28% in 2021. And suicide attempts increased from 14% in 2016 to 19% in 2021.
So obviously some things that prompted that we need to continue to work on this and develop some strategies to address these increases that we're seeing in our community. Mm-hmm. Substance-free resilience. How about some of the stats there that prompted this to be an area of focus?
Yeah, thank you. So substance-free or substance use had similar impacts on individuals. Individuals struggled in similar ways during the pandemic. So in 2019, we had surveyed using the same survey tools that mental well-being just mentioned. Since between 2019 and 2022, when we surveyed again, we saw increases in cigarette use. We saw increases in vaping. We also saw increases in marijuana use, both medical and recreational. In addition to that, we have seen more adults who are reporting negative consequences from drinking alcohol. And we've seen similar, I think the numbers started to dip a little bit right before COVID with opioid overdoses. This last year, we had 115 calls where first responders used Narcan which is an opioid overdose reversal drug. So that's a lot. We're seeing nationwide, we're seeing increases in opioid use, and that's trickling down here in Midland as well. And then when we surveyed our youth last year, we also found that 11% of young people in grades 6 through 12 are using vapes, with a smaller number in 6th grade and a much larger number, almost a quarter of 12th graders report that they're using vapes. And then the other thing that concerned us was the perception of risk of marijuana use among youth. Perception of risk is inversely related to substance use. And so when kids think that it's not risky, they are more likely to engage in that behavior. So we are concerned about the reduction in their perception of risk.
Okay, thank you. And then Brent, how about healthy living? What were some of the key stats there?
We look mostly at risk factors and health behaviors, and when we think about physical inactivity rates that are trending up. So it's not a huge trend in the wrong direction, but it is trending in the wrong direction. And if you couple that with those that we surveyed, only 40% of them actually meeting the physical activity guidelines that are set to maintain a current health, not even improve. Also coupled with our increasing obesity rates above 40%. Those are things that led us to our strategies for physical activity and healthy eating. And then preventive services, we looked at cancer screenings, vaccination rates and things of that sort. So when we looked at chronic diseases, diabetes, for example, diabetes mortality is increasing while screenings are going down. Cancer screenings, there's been some changes to the guidelines for that. So for example, for colorectal screening, 45 is the new age for that, and less than half of those in that age group have never had any kind of colon cancer screening. So that's what we were looking at, and we could go all day talking about certain stats and data for that, but those are just a few examples that led us to our strategies.
Great, thank you. Yeah, and really, we're so blessed in this community. We have some rich data. You've talked about the Midland County Health Survey that we did, the Youth Developmental Asset Survey that we did. I know we also looked at the We Hear You data that looked at marginalized populations and the impact there. We had the county health rankings, kids count. So we've got a great amount of data that really helped to ground this. But as we get ready to launch the new plan, let's just spend a couple minutes talking about what was done under the old plan and what was accomplished. So we'll start here with substance-free resilience. So what were a few things that were accomplished in the past with that?
So just looking at 2022, I mean, we've done a lot over the last several years and have aligned initiatives and brought some new roles into play that have helped us to work together better as a community. But just here in 2022, we had identified, and actually this leads into some of the changes in the plan, we had identified a lot of redundancy from coalitions addressing adult needs and coalitions addressing youth needs. And so in 2022, we decided it was time to consolidate our coalitions so that we were working together, looking at the community as a whole community. We hosted our first youth development conference underneath that coalition, which brought together a number of people, over 70 people attended, who are interested in supporting youth and reducing mental health challenges and substance use challenges. And then we worked on some social norming campaigns this year. We did the Good to Know campaign, which educates the community on cannabis use, harm reduction in cannabis use. And we also have continued the Get Your Head Out of the Clouds campaign, which we work with high schools and high school students on. And lastly, and probably the biggest accomplishment for 2022 was citing that opioid overdose data. We were invited to become a pilot county for an opioid fatality review team, which is like a child death review team. We partnered with Dr. Bodnar, 1016 Legacy Center, and established an opioid review team, and we held our first meeting. So that was our biggest accomplishment for the last year.
Great, thank you. Thank you, that's exciting to see. How about healthy living?
Yeah, we had a handful of accomplishments. A few key ones that we'll talk about just over this past year was our Food Navigator. Partnership with My Michigan Health, the Midland Business Alliance, and the Farmers Market, we hired a food navigator to have in place at all of the farmers market days. That person assisted with SNAP benefit education while they were there. They handed out recipe cards. There was some sampling days where they would do a demonstration and actually sample some healthy recipes, and then just general navigation throughout the farmers market as well. Another one was our prescription for health class. So in partnership with MSU Extension, there's these classes that we offer offer where if they attend these classes and they're learning about healthy nutrition, they can get vouchers to the farmers market. And we increased the amount of classes that we had this year, 57 participants in total, and we handed out it was over $2,000 that we handed out, and we had about an 84% redemption rate, which is quite a bit of a difference from the previous years that we've seen. So that was great to see that. And another accomplishment that we had was our health fair. So we held a fairly good-sized health fair at Dow Diamond. Some of you I know attended that. We had over 300 people that were in attendance there. I think it was actually probably over 400 people there. Several booths that were there to give resources and provide education to everybody in the area. We had 2 fitness classes taking place while that was happening, so that was really cool. And part of the Food Navigator connecting to that too is the Regrow Midland, and they handed out over 450 meals, lasagna meals, at that event as well.
Great, good. And mental well-being.
Sure. So one of the major accomplishments for mental well-being was the development of a behavioral health telehub. And so what that is a group of crisis response workers, social workers, and navigators who help the people who come to the emergency department who are having a behavioral health crisis. And so through telemedicine, if a person comes to the emergency department and they need to be evaluated and helped, this telehub, the staff at the telehub will see them, will talk with them, they'll decide whether or not that person might need inpatient care, and then help them define that next level of care, so the psychiatric bed. Or else, if the person is good to go home, they'll develop a safety plan with them, and then follow up with that person as well. So after that person's been either hospitalized or discharged, the telehub will call and follow up with them to make sure that they're okay. And this is really a big step in our zero suicides care, to make sure that all people are safe. And this is a partnership with My Michigan, Community Mental Health for Central Michigan, who does the overnight staffing for the telehub, and then also 1016, who has a wellness advocate who sees people who have substance use disorder and helps them to find their next level of care. So it's very exciting. It's 365, 24/7 care that we didn't have previous to that.
That's great.
In addition to that, our Wellbeing Coalition has been doing a lot of work to promote well-being science, wisdom, and practices in our community, and has worked to enhance overall well-being and prevention. We have worked to increase comprehensive supports for Midland County schools, students, and staff through multi-level programming, staff training, and direct services to our schools. And part of that has been through increased behavioral health therapists in our schools.
Great. So there definitely have been some positives that have happened over the last year, but we know, as we talked about the data earlier, there's more work to do. And there's some deficits that we've identified. So, it's one of those, we want to be thankful for what's happened, but then what's next for us to accomplish together? What are we on to next? So, and certainly as we looked at the data, it underscored the need for new strategies. So could each of you please share the top 2 or 3 strategies you plan to undertake with this new plan? So we'll start with healthy living, and I think I'm on the right slide there. Yep.
Sure,
okay.
Thank you. So within the Healthy Living team, we have 3 goals, and those 3 goals are increasing access and knowledge to physical activity, healthy eating, and preventive services. So just a few kind of high-level look at some of our strategies is adding physical activities to current events. So think about things that happen downtown, certain events downtown. We want to add physical activity to that, where you generally would not see a physical activity. So that might be a class that's happening, something that we can do downtown, work with the downtown authority potentially, and have physical activity classes taking place on a regular basis. Just something to offer to the community, and then enhancing current physical activity offerings already that exist. So an example would be the Tridge Walk. Expanding on those services and what we can do to enhance that, add a nutrition element to that, connect them to the farmers market potentially. Things of that nature would be what we'd want to do for healthy eating. sustaining and growing the food navigator role. So while they were previously only really part of the farmers market, we want to expand and grow on that. So what more could they do to have a more county-wide or even regional-wide role as a food navigator, teaching SNAP-Ed benefits and connecting people to resources for healthy nutrition. And then preventive services, we're promoting vaccinations, providing education, and promoting other services as well. So specifically thinking about cancer screenings, not only just promoting, but potentially providing those. So looking at how we can offer cancer screenings on more of a reach the people where they're at kind of idea and concept.
Great, wonderful. So yes, so some great plans underway, and I know we'll come to a spot here where we'll invite the community to engage. So if you have ideas on some of these things that we're discussing, there'll be an opportunity for you to become a part of it too. So, so next, let's talk about mental well-being.
Sure, we have a few goals also that we're hoping to accomplish. When we were seeing that data on depression and anxiety, we really thought that we needed to impact that. And we also want to be mindful of marginal groups. But if we're seeing 41%, that's a very large number of people who are experiencing these types of problems. So one of the things we want to do is increase our screening. Already we screen these things at doctors' offices, but we want to make sure that all the doctors are making sure that they ask these questions and ask them in a way that opens up that conversation. And additionally, there's some universal screening tools that are out there, and we need to promote those. So My Michigan, for example, has that on Facebook, where we'll ask you questions on depression, and people will take that. And if they are high on depression and they say that they're willing to have a contact, that behavioral health telehub that I was talking about earlier will actually contact you if you want to have some help around that. And CMH for Central Michigan also has screening tools available. We also want to raise awareness of mental health resources that are out there. There are many providers of mental health, but sometimes it's really hard, especially if you're in a mental health crisis, to find that and to navigate a mental health system. It can be very difficult. So we want to make that easier. We have a My Hope portal where people can go and find mental health resources. And so working with 211 to make sure that there is an awareness of that. The My Hope portal is powered by 211, and helping also in workplaces so that human resources departments understand, some of their folks might be having these types of issues. People could go to their human resources and really take advantage of some of the employee assistance programs that are out there. And so we just really want to raise awareness around all of the resources that are there and make sure that people have access to care.
We found that one of the best or most effective ways to improve well-being overall is to increase positive assets. So some of the other work that we're doing across the lifespan is identifying organizations that are currently promoting well-being, implementing strategies to increase positive assets, and also determine and measure outcomes to see if the work is really helping in this area.
Great. And then plans for substance-free resilience.
Well, and I want to piggyback on what Dina just said about assets. Assets don't just impact mental health, they also impact all risk behaviors, especially in youth, but we look at that in older adults as well. And when it comes to individuals who are in recovery, we use a similar framework called Recovery Capital. On our screen, you see our major goals and objectives. One of those is around developmental assets and recovery capital. And what I think is really interesting about the new plan is how it interfaces, how it crosses one program to the other or one area to the other. So we will also be working on developmental assets, and one of the ways that we'll be doing that is through building on that conference that we had last year, continuing to educate our community on what developmental assets are, and helping organizations in our community figure out how to implement those in their everyday work. and to be very intentional about that. And we'll also be working on some social norming campaigns again, adding in one around stigma this year, because stigma is a huge barrier to people seeking treatment for substance use disorder. And then a couple from the opioid fatality review team. Our first goal from that team is to increase the number of Narcan safety kits that are available in our community. Those will basically be kits that have Narcan. All of the staff in a business will be trained to be able to use those. They'll have all the tools that someone needs to respond immediately to an opioid overdose. And then and we'll make sure that those are in all places that have AEDs. That's our first step. That way they're equipped to deal with that medical emergency. And then we're going to continue building on that opioid fatality review team with a goal of having 4 reviews this year, and the robust conversations that come out of that and help us to identify other gaps that we could be filling.
All right, so some great pieces that we have in place to start. And I think one thing that's important to know is this is an ever-evolving plan, because we start with some strategies and we learn some new things. And so this will be ever-evolving. And again, that's where we can look at community input to help us as well. So we've got some great strategies in place. So how will you know if you've made progress on these? So can you share maybe a few metrics of how do you know if we're making progress? What are you going to be measuring and looking at?
Yeah, well, I can start with that. So around depression and anxiety, our plan is to continue to complete those surveys, and so we would hope that we see those numbers come down. In different settings, we would be measuring things like in a doctor's office. Oftentimes we'll ask about depression and anxiety, and so we would hope that we also see those numbers go down. And mental health providers also should see that as they're looking at outcomes for their patients.
Our team that is looking at raising mental health awareness and promoting mental well-being will be looking at the number of registered users for different mental health apps, the number of social media mentions for things like My Hope Portal and the MoodFit app. And our agencies also will continue to collect data and share among ourselves as well.
So for our group, we do pre and post surveys for most of our classes, and that tells us whether or not somebody is ready or wanting to change their health behaviors, even the knowledge behind what they know about health behaviors, what they should be eating, drinking, physical activity guidelines, things of that nature. We'll be looking at participation rates, vaccination rates, screening rates for cancers. Those are kind of our shorter term, what we'll look at for our success and our strategies. Longer term, over a few years, we'd like to see the trends. So we'll see late term diagnosis is going down once we know that screenings are going up. We'll see smoking rates decrease, diabetes mortality decrease. Those are the things we'll be looking at longer term to determine the success of our strategies.
Yeah, and similarly, we'll be measuring outputs and outcomes for programs, for attendance, for how many people are viewing our social media campaigns, et cetera. But when we look at substance prevention, the biggest way for us to measure that is long term. So we'll be looking at those 5-year trends with youth and substance use among youth, as well as their developmental assets. We'll be looking at some of our local substance use treatment providers are going to begin measuring recovery capital this year. They'll be able to see some of those trends starting up even earlier. And then certainly looking at the community health needs assessment substance use numbers. But really often in this space, we're playing the long game.
And I think that's a great point that you all bring up, because there are specifics that you can measure now, but the reality is to really see the change. These are not solved in the next year issues. These are long-term issues that are going to take really the focused attention, which is the beautiful thing about Health and Human Services being involved, is you have really a cross-sector collaborative group coming together to work on this. So we know that, yes, we can measure some of these, but it's going to be the next youth asset survey time, the next community health time that we'll really be able to measure, which are a few years down the road. So we know we got a long game going, as we're talking about here. And as we think about, community health improvement plan, it's meant to improve the health of our community. But I think the other piece of community we could put in there is how can the community get involved? So I'd love for you to, whoever, just share some thoughts on how you welcome people getting involved and what they could be a part of. So whoever wants to go.
Sure, I'll go first. So we have a mental health coalition, and so we're always welcoming new voices at the table for our coalition meetings. And so you have our contact information, so feel free to contact either me or Dina if you're interested in being more involved in our mental health coalition, because we need everyone at the table if we're going to have collective impact. And so sometimes when we put together a coalition, there is a voice that might be missing, and that is sometimes the voice of the person with lived experience. And so we make an effort to make sure that that voice is at the table, but I would very much welcome anyone who wants to come aboard. Mm-hmm.
I would encourage you to visit our portal. We have an excellent resource in our community called My Hope Portal. It's mihopeportal.com. If you could not just visit the portal, but share information on your own personal and your agency's social media about the portal, as well as a free mental health app called MoodFit. I encourage you to download the app, share that on your social media, and kind of spread the word about the resources that we have available in our community.
We're always also hopeful around anti-stigma, and so if people in the community can just share and be vulnerable and talk about what they're going through, then it can lower that stigma about talking about behavioral health issues. And so I'm sure Catherine also would agree that talking about some of the things that you go through in your life, it kind of normalizes that, so more people feel like, well, I can reach out and get that kind of help.
Yeah, likewise, we have our Healthy Living team, and you can contact me to get involved in that, but we're always looking for more active participation. If there's classes that you want to teach in nutrition or physical activity, or even if you're a provider or a nurse and want to be involved from a preventive health services standpoint, by all means, we'd love to have you on the team. So that's a good way to get connected with our Healthy Living team and some of those strategies as well.
Yeah, and it sounded like even some of the events you want to do, you could use people that have some energy around participating and helping with events too.
Yep, of course.
Yeah, and I just want to add that, of course, we certainly have a coalition that works on substance use disorder and prevention, but I want you to also take a look at the opportunities in your own life, because as an individual, we can each have an impact on someone, and that makes a big difference. So take a look at the opportunities you may have to support a youth in your life, figure out what your skills are and how you could be impacting a young person, because that's going to have a big impact on preventing them from engaging in risk-taking behaviors. And to piggyback on Kathy, just be conscious of the way that you approach someone who might be struggling, because the way that you talk to a person may build on the stigma or may create a barrier to them seeking the help that they need. So I think if we can be open and accepting regardless of someone's walk and support one another, we're going to have as big an impact as we might be able to, just at that individual level.
Yeah, so the common theme is talk about it. Talk about these issues, talk about your personal struggles, whether it's with getting enough physical activity, eating right, substance, mental health, and be open and listening to others and just listening to what they have to say and looking for ways that you can support them in that endeavor. So what are you most hopeful about as we launch this new plan? So, okay, here we go. We're launching the new plan. What are you most hopeful about moving forward?
I'm very hopeful. I'm hopeful that as we look at increasing awareness of the resources available and sharing our own stories, that we can really impact and reduce stigma associated with getting help. My hope is that someday in the near future it will be just as common to ask for a mental health referral from a friend or family member as it is for a referral for a physical health care provider.
I'm hopeful that we'll have more participation. Knowledge and access is great, and I think that I'm hopeful that we'll increase both of those, but I think the action is what I'm hopeful that we'll be able to increase, community-wide, more action in some of the strategies, more involvement in some of the strategies, and I think that that's going to make success for a lot of our strategies, and kind of on a larger scale, maybe create a model that other communities could utilize to be able to improve the health in their own communities as well.
Yeah, and I would hope to see our community establishing healthy norms around substance use, helping people to find ways of coping with those day-to-day ups and downs so that they don't rely on substance use to get through a tough day, and to really reduce the harm that can happen from unhealthy substance use.
Great.
I'm really hopeful that people will be able to get the help that they need, and that we really will be able to have, a vision of being an inclusive community where everyone thrives. And so, I think that is a great vision and aspiration. I think we can get there.
Great, wonderful. So today, as we're launching the new Community Health Improvement Plan, we've talked about the why of these areas, and we've looked at some key stats, and some, honestly, some very disturbing stats about our community that need to be addressed. We've talked a little bit about some of the accomplishments from the past, but then we've looked ahead at what do we need to focus on, and we know there's a lot of work to close these gaps. And but we're very hopeful too, and I'm hearing that a lot of this is let's talk about it, let's normalize it, let's make sure people are aware. And again, we invite you, if you would like to engage as a community member or your organization would like to engage in any way, we invite you to join one of these teams or all of the teams, depending on what your bandwidth is with all of this. But we invite you to engage. And then also we've listed both the Facebook page and the website for the Health and Human Services Council as well. So you can see updates for what's happening along the way. So thank you all for being here. And I know we did allow some time for questions and answers here at the end. So I would open it up if we have any questions from the audience here. Any questions that you would like to have addressed?
Do you have any youth representation on the council?
Okay, yeah, the question is, do we have any youth representation on the council? Yes, Health and Human Services Council does have a youth member on it. It's a high school student that's on it. And that's been a really great thing to have a youth voice at the table. And although when I think about our work teams, I'm not sure that we do have any youth representation on some of these specific work teams. So we would definitely welcome that. If there are youth in the community that would like to engage, we'd welcome their engagement in this. So yeah, great point that you raise. Because it is important when we're doing strategies for people, we want to do strategies with people. So it is important to do that. Other questions? Okay, well, thank you all for being a part of this, whether you're here in person, braving the snow today, or you're watching us online. We really appreciate your participation and your interest in this topic. And again, we invite your involvement as we move forward, working to address some of these critical issues in our community. All right, thank you all.
Thank you.